Have you ever heard of DUBIN-JOHSON Syndrome? If you haven't, you're not alone. This is a rare genetic liver condition that isn't widely known but has a significant impact on those it affects. At its core, DUBIN-JOHSON syndrome is caused by a mutation. This mutation leads to an accumulation of a substance called bilirubin in the liver. Now, bilirubin is a normal part of our bodily processes, but in excess, it can lead to lifelong mild jaundice symptoms. Jaundice, if you're not familiar, is a condition that causes yellowing of the skin and the whites of the eyes. It's often associated with liver disease. But here's the thing, DUBIN-JOHSON syndrome can affect anyone at any age. It doesn't discriminate. It's a lifelong companion for those who have it, often flying under the radar because its symptoms are so mild. Now that we've defined what DUBIN-JOHSON syndrome is, let's delve into how it is diagnosed. So, how can one identify DUBIN-JOHSON syndrome? Well, diagnosing this rare genetic liver condition involves a couple of key steps. Initially, a physical examination is carried out, but the real telltale signs are found in the blood tests. These tests reveal an elevated level of bilirubin, a substance that the liver typically filters out. In those with DUBIN-JOHSON syndrome, a genetic mutation prevents this filtering, causing bilirubin to accumulate in the liver. Now, what does this mean for the person with the syndrome? Well, they might experience chronic mild jaundice, a yellowing of the skin and the whites of the eyes. It's a lifelong symptom, but it's usually mild and doesn't cause any harm. Some people might also experience fatigue, weakness, and abdominal pain, but these symptoms can vary widely from person to person. It's important to remember that while these symptoms might sound daunting, the syndrome does not impact the person's lifespan. Understanding the symptoms and diagnosis process is essential, but how prevalent is this condition? You might be wondering, how common is DUBIN-JOHSON syndrome? Well, let's dive into the world of numbers to answer that. DUBIN-JOHSON syndrome is considered a rare condition, with its prevalence varying across different populations. Now, you might ask, how often does it occur? This is where the incidence rate comes into play. The incidence rate of DUBIN-JOHSON syndrome is not universally documented, as it's a rare condition. However, it's known to affect certain populations more than others, indicating a possible genetic link. On the topic of genetics, it's interesting to note that DUBIN-JOHSON syndrome does not discriminate between genders. It affects both males and females equally, making the male to female ratio a balanced 1:1. So there you have it, a glimpse into the epidemiology of DUBIN-JOHSON syndrome. We've looked at how common it is, but what about survival rates? Living with DUBIN-JOHSON syndrome, what does it mean for one's lifespan? Now, this is where the silver lining shines through. The syndrome, while lifelong, does not shorten or impact the lifespan of those affected. Instead, the focus of treatment typically revolves around managing any underlying illnesses that may accompany the condition. This is a testament to our resilience as human beings, able to adapt and thrive even in the face of challenges. But what about the future generations, you might wonder? This is where genetic counseling comes into play. It is an invaluable tool for family planning, offering guidance and insights into the genetics of the syndrome. This knowledge empowers individuals and couples to make informed decisions about their future, ensuring they are well prepared for whatever may come their way. In conclusion, DUBIN-JOHSON syndrome is a unique condition that affects the liver, but with proper management and understanding, it doesn't have to impact the quality of one's life. Like, share, comment, and subscribe.